Every year, doctors write millions of prescriptions with the goal of protecting your health. But as a doctor, I have to tell you, there is a truth hidden inside those bottles that many people never hear. Some of the most common pills handed to seniors can actually weaken the very organs they are meant to protect, which is your heart. These are not rare or experimental drugs. They are likely in your medicine cabinet right now. I'm talking about pills for reflux, for pains, cholesterol, and blood pressure. You see, the American Heart Association knows that over 70% of adults over 60 take at least one of these daily. Many assume that feeling tired or dizzy just part of getting old, when in reality, the pill itself might be the silent culprit. Today, I'm going to review the 7 pills that could be damaging your heart, backed by the latest research. So stick with me because number 2 is one of the most prescribed drug in the world, and its side effect will shock you. Now, number 7, acid reflux pills. Let's start with those little capsules for heartburn or gastroesophageal reflux disease get. They feel like a lifesaver when they stop that burning sensation after a meal. But here is the problem. These pills work by blocking stomach acid. Now, we need that acid to absorb minerals like magnesium, vitamin B12. Research from the Mayo Clinic shows that when you shut down that acid for too long, your magnesium level can plummet. Why does that matter? It's because magnesium is the fuel for your heart electrical activities, for your heart electrical system. Without it, you are at risk of palpitations and irregular breathing. In fact, Stanford University found that seniors on this long term had 20% higher risk of heart attack. So this is my advice. Many of my patients find relief just by avoiding late night meals or losing a little weight around the waist. Always ask your doctor if you really still need that refill. Then number 6, over-the-counter painkillers, NSAIDs. Now, next up are the bottles sitting in almost every kitchen drawer, ibuprofen and naproxen. We take them for arthritis or a sore knee and take it over the counter, so it's safe. But fortunately, these drugs can be very hard on your heart. They block enzymes that actually protect your blood vessels. When these are blocked, your blood pressure rises and your arteries can stiffen. A major Danish study found that seniors taking this daily had 31% higher chances of cardiac arrest. So if you are dealing with mild pain, try alternative with acetaminophen, paracetamol, or using heat or cold therapy. If you must use these painkillers, use the lowest dose possible for the shortest amount of time. Before we move on to number 5, if you are finding this information helpful, please take a second to hit that subscribe button and click the notification bell. My mission here is to help you navigate your health with confidence, and I'd love to have you as much as part of our community. Now let's go back to the list. Number 5, some diabetic medications. For millions of you, diabetes pills are a lifeline, but some older medications, specifically one called rosiglitazone, come with a heavy heart cost. While it may help manage blood sugar, research in the New England Journal of Medicine found that it was linked to 43% higher risk of heart attack. It can cause your body to retain fluid, putting a massive strain on an older heart. So the good news is medicine has evolved. There are newer classes of drugs like the SGLT2 inhibitors that actually protect the heart while managing the sugar. If you're on older diabetic medications, it might be time to have a friendly chat with your doctor about an upgrade. Then number 4, steroids, corticosteroids. You might know these as prednisolone or similar pills, often prescribed for arthritis, flare-up, asthma, skin issues. In the short term, they feel like a miracle because the swelling vanishes and the pain stops. But for the heart, they can be a heavy burden. Steroids tell your body to hold onto salt and water. That extra fluid doesn't just stay in your ankle, it enters your bloodstream, spiking your blood pressure and forcing your heart to pump much harder. The British Medical Journal found that seniors on a long-term steroid were twice as likely to develop cardiovascular disease. If you are prescribed this, always ask your doctor if there is if there's a steroid sparing alternative, or if physical therapy may manage the underlying issue instead. Then number 3, heart rhythm pills, which are the antiarrhythmics. This sound backward, doesn't it? Pills meant to feel irregular heartbeat can sometimes make it worse. Drugs like amiodarone are powerful, but they can be a double-edged sword. Amiodarone can build up in your tissue over time, potentially slowing your heart rate too much. and leading to dizziness or even fainting. In some cases, as seen in the Journal of the American College of Cardiology, these drugs can actually increase the risk of heart failure in vulnerable patients. Today, many cardiologists are moving towards safer strategies like catheter ablation. If you're on these medications, regular monitoring is not just a suggestion, it's a necessity. Then number two, blood pressure pills, the beta blockers. The one I warned you about. Beta blockers have saved millions of people, and for many, they are essential, but as we age, our body processes them differently. In some seniors, these pills can slow the heart down too much. This reduces the oxygen reaching your brain and vital organs, leading to fatigue and fog that people often mistake for just getting older. A study in the European Heart Journal shows that for frail seniors, this can sometimes tip the balance towards heart failure because the heart isn't allowed to pump forcefully enough when the body needs it. So always check your pulse and your blood pressure at home. And if you feel constantly wiped out, talk to your doctor about whether those doses needs a tweak. Then number one is the cholesterol pills, the statins. Finally, we have the most prescribed drugs in the world, statins. You will likely know them as atorvastatin or simvastatin. They are great at lowering cholesterol, but they also block a very important compound called coenzyme Q10. Think of coenzyme Q10 as the spark plug for your heart cells. Without enough of it, the heart muscle can become weak and tired. This can lead to muscle pain and, in rare cases, impaired heart function. While statins are life-saving for heart risk patients, for some seniors, the benefit might be smaller than the risk of side effects like muscle decline. If you are on statin, ask your doctor if supplementing it with coenzyme Q10 is right for you, and always keep an eye on your energy level. Covered a lot today, from reflux pills to statins. The big takeaway is that these medicines are evil, is that they are powerful and they need to be managed with care. And most importantly, never stop taking a prescribed medication on your own. That can be dangerous. Instead, use this information to have a better conversation with your doctor. Ask, is this dose still right for me? Or are there lifestyle changes I can make to reduce the need for the pill? Then small changes like a daily walk, cutting back on salt, or improving your sleep can often do more for your heart than any pill bottle ever could. If you found this helpful, please share this video with a friend or a family member who take these medications. Let's look out for each other. Thanks for watching this video, and remember, your heart deserves the best. I am Dr. Emmanuel Bale, and I will see you in the next video.